We're here today to talk a little bit about colon cancer and focus specifically on the screening aspects. This is a topic that's been in the news a little bit lately with the tragic death of Chadwick Boseman, who many people know from the Black Panther movie. He died at a young age, which is what we're finding is that colon cancer is starting to affect more people at young ages. And so I think it's really important that we spend a little bit of time to really understand a little bit more about colon cancer, what the risks are and what the screening options are so that we can find it early and potentially find cures for our patients. So that's what we're going to talk about. And many of us consider colon cancer to be the silent killer. And so I'm going to give you some examples of why that's the case. First of all, what is colorectal cancer? It's a cancer that affects the lower intestine. So this is the colon and the rectum. Your colon or your large intestine is about 3 feet long in most people. It is the end of the digestive tract. It travels all around your abdomen and then ends up down at the rectum. And so that's, we've got just a quick little picture of the anatomy, but the way that colon cancer starts is it starts out as a polyp, and that can occur anywhere in the colon or rectum. These polyps tend to grow very slowly over time. Most of them take several years to really develop. And eventually, if you give it long enough or the polyp becomes aggressive enough, it can turn into a cancer. The cancer then progresses into the wall of the colon, then potentially to the blood vessels and lymph vessels, and then it can spread to other parts of the body. And so we're going to talk about what these polyps look like, the progression of the cancer, and how we can find these things as early as possible. So this is just a quick look at what these colon polyps look like when we see them on the inside of the colon, and typically these are found during colonoscopies. And then at the top of the screen you can see there's just the progression from a tiny little polyp on the left-hand side all the way to a full-blown invasive cancer on the right-hand side. So who's at risk? Up to half of all Americans are going to have polyps at some point in their life. So a lot of people are at risk. Only about 10% of those precancerous polyps will progress to cancer, but it's still important to identify those polyps in anybody who may be at risk. So colon cancer overall is the third most common cancer in America, affecting both men and women. There's about 140,000 new cases diagnosed every year. We can attribute about 50,000 deaths a year to colorectal cancer in America. And just for an example, about 1 out of every 20 men could be diagnosed with colon cancer in their lifetime. So it's very common, very prevalent. There's a good chance that if you live long enough, either you or somebody that you know is going to be affected by this disease. So I'm going to break down the risk factors for colon cancer into things that you may not have any control over versus the things that you may have control over. So the things that you really can't change in terms of your risk for colon cancer is any sort of familial relative that may have cancer. Some of these things can be genetic. So if you've got especially a first-degree relative, mom, dad, siblings, even maybe grandparents who've had colon cancer, that may put you at an increased risk. Inflammatory bowel diseases such as Crohn's disease or ulcerative colitis also tend to increase your risk for colon cancer. And then there are very specific genetic syndromes such as Lynch syndrome or familial adenomatous polyposis, which is FAP. Those have high incidences of colon cancer. They're extremely high risk. As you get older, your risk increases. Obviously, you can't control that. There's a higher incidence in certain races, including African Americans. And then gender, there's a little bit of a bias toward women for colon cancer. So that brings us to the risk factors that you do have control over, and specifically things like smoking, moderate to heavy alcohol use, both increase your risk for colon cancer. The diet that we tend to gravitate to here in the South, which is high fat, low fiber, that also increases your risk for colon cancer. Uncontrolled diabetes, obesity, and physical inactivity all can increase your risk for colon cancer as well as other cancers. So this is one of the more important slides, I think, to really discuss what are the symptoms of colon cancer. The key point here is early in colon cancer, there are absolutely no symptoms. And that's why we call this a silent killer, because you or I could be walking around with a colon cancer and never know it until, unfortunately, it may be too late to even be treatable. So once you do start having symptoms, the common things that you would find are blood in your stool. You may have anemia even if you're not seeing blood in your stool, because some of that blood just might be hidden. You might see a change in your bowel habits where it's just more difficult to pass your stools, or things just are different than they used to be. Lower abdominal pain, usually a sign of more advanced cancer. Increased urgency to have a bowel movement. If you have a decreased appetite, or just you're losing weight for no reason. Your appetite's the same, you're eating the same, but you just keep losing weight unexpectedly. Those are all pretty concerning symptoms, and if you have any of those, certainly need to get checked out. It doesn't mean you've got colon cancer, but they all warrant a closer look. So the current screening guidelines are changing a little bit. Actually, they're moving the age back about 5 years. It used to be that we started screening everyone at age 50. Now the current recommendations are that we move it back to 45. And that's for just average risk people. People who don't have a strong family history, people who are not having any symptoms, just most people out there. We recommend starting the screening process at age 45. Currently, the recommendation is to continue screening every 10 years for low-risk individuals until you get to about age 75 or 80. And then if you have a higher risk, so if this tends to run in your family, then you're probably going to want to start the screening earlier, maybe even at age 40 or earlier, depending on at what age that your family members were diagnosed. And then for higher risk people, we also increase the screening to every 5 years instead of every 10 years. And then if you are found to have colon polyps, we generally do the colon polyp screening after that for every 3 to 5 years. So that's what that looks like. I'm going to go over some of the common screening options. And I think just from the get-go, I want to stress that the actual type of screening that you choose isn't going to matter so much as just the idea that you're going to get screened. So if you're out there at least looking for these things, all of these screening tests have some value. Probably the cheapest, easiest, and but least accurate is going to be just a blood in your stool, the little cards that you put the smear of stool on and they look for blood. The old-fashioned ones would pick up blood from just about anything. It could even pick up blood from if you ate a medium rare steak the night before, the blood from that steak could be picked up on those cards. So those are really not very accurate. I don't generally recommend those just because they don't give you as much valuable information. The next step up from that is going to be the FIT test. And this is a test that tests specifically for human blood in the stool coming from the lower intestine. So it's a lot more specific, and it gets rid of all the, a lot of the false positive results that we were getting with just the standard blood in the stool cards. So these are relatively inexpensive compared to some of the other screening options. They're pretty readily available. The results come back fairly quickly. The downside is that if you end up having a positive test on one of these FIT tests, then you really do need to, it's very important that you follow up with some sort of additional screening. This is just a very general idea. It gives you some idea that you may be at some elevated risk, and so it's going to need to be further evaluated. The next step up from that, which is a little more expensive but a lot more specific, is a product called Cologuard. And this actually tests for specific DNA sequences that are typically shed by polyps. So if you have a positive Cologuard, there's a much higher chance that you've actually got colon polyps. It's not just looking for blood, it's looking for actual DNA from polyps. And then again, this is something that if you have a negative test, it's good. It's a pretty good indication that you're low risk, but you would need to do this one every 3 years. And if you do have a positive result, then you're going to need to follow up with a colonoscopy after that. Another option, which we don't use very much anymore, is a barium enema, and this is where you inject contrast up the rectum, so it's a little uncomfortable. You still have to clean your colon out. You don't get any sedation for it, so it's kind of an uncomfortable exam. That would all be okay, but it's still not as accurate as some of the other options. So it'll pick up masses, it'll pick up polyps, but they've got to be fairly good size to be picked up. And so, and then if you do find some abnormality on the barium enema, then you still have to go through with a colonoscopy as well. So we really don't use the barium enema very often anymore. CT colonography is a new X-ray modality that we're using, which actually helps. It's better than the barium enema. It still requires that you clean out your colon prior. But it's good at picking up smaller polyps than you see on the barium enema. It's probably a little bit more accurate. It's going to be more expensive, and then again, if you find any polyps on the colonography, you still need to have a colonoscopy afterwards. Also, it's still a little bit uncomfortable because you still have to have the injection through your rectum, and so it's not exactly pain-free or discomfort-free. But it is becoming an increasingly used option. And these are just some examples of pictures that you might see on the CT and then on the subsequent colonoscopy, what it looks like, what we've picked up. And then we have this is kind of an example of what it looks like on the inside of the CT colonography. It's pretty cool. This technology, the way that the computers take the x-rays and then reconstruct them, allows you to almost do a fly-through of the colon, which is, it's pretty neat technology. And I think that we may be moving more in this direction in the future, but that kind of remains to be seen because it still is relatively expensive. So kind of the gold standard for screening options is going to be the colonoscopy. And we've been doing these forever. This is basically where the physician runs a long tube, which is about quarter of an inch to a half an inch around, up your rectum, around your colon. So again, your colon's about 3 feet long, so we're going all the way around your colon. It's got a light and a camera on the end to allow us to actually visualize everywhere along the inside of your colon. And so this requires that you have the procedure usually done in a hospital or a surgery center. It's going to be a little bit more expensive. It's more invasive. It's probably a little bit higher risk, and it requires somebody who's got some level of expertise to actually do the procedure and be able to identify the polyps and masses that we're looking for. But having said that, it's going to be by far the most accurate form of screening. You're going to find polyps that are much smaller than you would find on any of the x-ray tests. And the biggest advantage of this is that if you do find a polyp while you're doing the colonoscopy, we can go ahead and remove the polyp, which if we can take the polyp out before it turns into a colon cancer, then we've effectively prevented the colon cancer from happening in the first place. So I think that this is, and this is also the procedure that you're going to have done. If any of the other tests come back positive, then they're going to recommend that you go ahead and have the colonoscopy done. So like I said, I would consider this pretty much the gold standard for identification and treatment and removal of colon polyps. And in some cases, when we do these, we actually find, again, that people who have not been having symptoms do have a colon cancer, at which point we can take biopsies, we can mark its location, and we can do all the things that we need to do to prepare the patient for potential surgery or whatever else needs to be done in terms of treatment. I think, talking to my patients, the most uncomfortable part of the whole thing is usually the day before when you have to do the colon cleanse, which you still have to do for a lot of these other screening options as well. And that's where you drink a bunch of liquid that just basically flushes out your whole digestive system. And then so when you come in the next day, everything's clean. When we put our camera in, we can see what we need to see and get done what we need to get done. So those are pretty much the main options for screening these days. And so I guess the next question is, let's say we find a colon cancer, what's the next step? So the treatment of colon cancer, depending on the stage, treatment's going to vary. So if we find something very early on, then we have much better options in terms of treatment and also in terms of hoping for a cure. And so that's really the goal of the colon cancer screening, is to identify these things early so that we have a much better chance of curing the disease completely and allowing people to live their full life. So I guess I should say, as far as treatment goes, you may, in some cases, it's just require surgery to remove the cancer. In some cases, it may also require chemotherapy, in some cases radiation. It's really just a combination of the location of the tumor and, and how advanced it is at the time that it was found. So I want to just recap things, the bottom line on this. Number one, colon cancer is very common. It doesn't matter if you don't have any family that's had colon cancer. It doesn't matter if you don't meet any of the risk factors. These things can come up at random and really affect just about anyone. And so it's really important that everybody gets screened for it. The other thing is, colon cancer is very preventable as long as we're actively looking for it, finding the polyps before they turn into cancers, and removing the polyps at that time. If we do that and we're regularly checking on folks that make polyps and removing them as they come up, in most cases we're able to prevent them from ever having to deal with a colon cancer. And that's really our goal. The next thing is that colon cancer screening works. We have seen that we've been actually able to make an impact on the number of deaths from colon cancer over the past 10 to 20 years because our screening techniques and availability have improved. And so it really doesn't matter, again, which method you start with. If you just want to do the cheapest, easiest, quickest thing to start, I encourage you to do that. It may, if you come back with positive tests on some of those stool tests, then it's probably going to lead you to have a colonoscopy or something else where we can start looking a little bit more invasively at these things. But the bottom line is, if you're thinking about it and you're looking for it, we're going to have a much better chance of finding it and getting it treated early, which is really what our goal is. So if you're over 45, if you have a family history of colon cancer or have any concerning symptoms, we want you to get screened, we want you to talk to a doctor, and we want you to figure out how we can prevent this from becoming a much bigger problem and potentially curing colon cancer when we find it.